introduce Jasmine Zhang. She's a third-year PhD candidate in clinical psychology at the University of Waterloo, and her research examines the impacts of digital media on the well-being of children, youth, and parents and caregivers. In 2024, Jasmine joined the inaugural cohort of Impact Fellows at the Children and Screens Institute of Digital Media and Child Development to further contribute to research and policy movements surrounding technology and mental health. Jasmine has also completed rigorous clinical training in providing psychological assessment and intervention services for children, youth, and adults from various locations in Ontario, including the Centre for Mental Health Research and Treatment at the University of Waterloo, the Waterloo Region District School Board, and Hamilton Health Sciences. Prior to beginning doctoral studies, Jasmine received her Bachelor of Science, Honors Psychology, Neuroscience and Behavior from McMaster University in 2020, and her Master of Arts, Clinical Psychology from the University of Waterloo in 2022. So please join me in welcoming Jasmine up to the stage. You want a hand?
Okay, and now I will adjust this so that you can all hear me. Thank you all so much for being here, and thank you for the warm welcome. I actually did my very first practicum with the school board, so it's it's really nice to be back here. And as I'm going to spend the next half an hour or so talking about parenting in the digital age, I imagine that many folks here, if not all folks here, are caregivers, and I would really like to acknowledge that this is a big topic. We're not going to cover everything, but I hope that you walk away from this with a little bit more knowledge than you did before. So screen use and child development is a big topic, right? I think like every other day there is a new article about this out in the media. So a lot of it is about, what social media use does to children's brains, what too much screen time might mean, all of those things. And on top of that, for parents and caregivers, there's this whole other layer in the media telling you what to do, what not to do, what to think, what not to think. It's ridiculously complicated. And on top of that, there is a lot of media about media. So I know recently, thank you, I appreciate that you all know what I tried to do there. So recently on Netflix, we know that the show Adolescence really made the rounds. I know there were some reactions from parents and caregivers to that. A bunch of other documentaries. There's the Jonathan Haidt book, The Anxious Generation. So there's a lot of information out there. And I think one challenge is that all of that information tries to present us with a really seemingly simple explanation, which is that media use causes or is related to poor health and well-being. And I think for today, I'm going to try and invite all of you to think about this from a more complicated perspective, because even though it is more complicated, I think it's a more realistic perspective that I've kind of tried to learn about over the past however many years I've been in grad school. So I think it's the idea that we have media use, and there's certain things that are going to increase the amount of media that certain kids and teens and even parents and caregivers use, right? And it is certainly true that there's going to be certain risks associated with that. Can you guys hear me okay? There's just an echo. Okay, cool. All right, and we know that being exposed to those risks is then associated with poorer health and well-being outcomes. And on the flip side of that, I think it's also important to acknowledge that media use has a lot of benefits, right? So it's not uniform, it's not unidimensional, and when children can reap certain benefits, they benefit from better health and well-being as a result. And so for today, I'm really hoping to invite all of you to think about how can we minimize the risks while also capitalizing on the benefits that screens can bring. Okay, so in terms of the actual risks, I'm going to talk about some of the more novel challenges that we're seeing, because I think it is important to understand how complicated all of this is and the different things out there that kids might be faced with in the digital world. Whether that be online aggression, so exposure to cyberbullying, we know that that's become a bigger issue since the pandemic especially. Other things might be like the perpetration of hate speech and more radicalization online. We also know that there's been a lot of questions about violent content and what that might mean for young people when they're exposed to that. And then as we enter the age of algorithms, dark design is essentially design features that might promote users to act or engage with platforms in a certain way. So we're talking about infinite scrolling, seeing the next video without actually seeking it out, or personalized algorithms that are more likely to keep users engaged with a platform. And then, of course, because there is so much information online, we're also exposed to more inappropriate content. And so it can be easier for children and youth to see things that are either not developmentally appropriate or just not appropriate at all. And so again, these are things that I think are important for parents and caregivers to be aware of, and it doesn't necessarily negate the fact that media use does bring a lot of benefits. So let's take a look at what those might be. Okay, so the first one, we saw this as an especially important tool during the pandemic, is social connection, right? We know that you might have a child who plays video games with their friends online after school. You might have a teen who has connected with other people online and found a really nice social relationship with them. We also know that tech opens up a whole world of learning and creativity. So whether that's kids looking online at tutorials or taking classes, those kinds of things. And of course, I think it's difficult to find a child or a teen who doesn't use devices for entertainment. It really is fun, like I'm not gonna lie, we all do it. And that can be very beneficial. And I think another piece for kids, and especially teens, that we want to be thinking about is identity development. So the online world offers so many opportunities for kids to explore who they are, who they might want to be, and the kinds of things that they're interested in. And that's especially useful for, say, marginalized youth, right, who maybe don't have access to people in their direct community who can support aspects of their own lives. So the online world really opens up a whole other sphere for them to find connection and belonging. And so with all that said, I think it's complicated, right? Like tech and media use doesn't necessarily always lead to mental health challenges. It doesn't always lead to benefits. And there are going to be times, and we see this in the research, where there doesn't really seem to be an impact or an effect at all. And so I think with all of this said, I really want to emphasize, like, parenting is really hard. I'm personally not a parent, but I know that having worked with different parents and caregivers, I know there's so much to be thinking about, to be doing all of the time. And even if you don't believe me, which I know you do, there's research saying that parenting today is harder than it was 2 decades ago. So this is from a 2020 survey that was conducted in the States. So for those who might be fielding questions from older generations, you can tell them that I said that you have harder jobs. Don't tell them that. Please don't tell them that. And the other piece that I want to drive home today is a lot of parents feel like parenting is harder because of technology. So some of them feel like it's harder due to tech in general. Others feel like earlier exposure is tricky. And then there's also questions about like devices being distractions, cyberbullying, smartphones, online predators, all of those things. And what that leaves, I think, often parents and caregivers, that leaves them in a place where there's a lot of questions and it feels like there are very few answers. So some common questions, and this is not exhaustive by any means, would be things like, is my child addicted to a screen? How do we stop arguing about screen time? I am so tired of having the same conversation over and over and over again. Or how do I keep my kids safe when I don't necessarily know exactly what they're doing online and I want to give them that privacy? Or, do I let my teen post on social media? And I think the tricky part is often it feels like there is no solution. Just by a show of hands, for those who are comfortable, has anyone ever felt like that? Okay, that's a lot of people. And I think the thing that I want to get you all to think about is that there's no one-size-fits-all solution. That doesn't mean that there are things that you can do to help your child, develop a more healthy relationship with media and kind of navigate the online space, because realistically, it's probably going to be here for the foreseeable future. And I'm going to focus the rest of our time today on what the American Academy of Pediatrics calls the 5 C's of media use. So these are essentially 5 different things that you can try and think about as you're starting to navigate the idea of how do we effectively manage children's media use. So I think in my work as a researcher and as a clinician, I definitely don't agree when some folks online are like, oh, just let kids do whatever it is online, like they'll figure it out, because realistically, that's like giving a toddler like the keys to a car. It's not gonna work, right? So this is hopefully going to be a roadmap that can get you thinking about some strategies that might work for your child or your teen. So I'm gonna pop these up on the screen here and then walk through each of them in more detail. And we'll start with the child factor. So this is really thinking about how every single child is unique. And because of that, every single child is going to face different risks online, and they're going to reap unique benefits from media use. So some questions that you might be thinking about, right? What do you know about your child? Even if you're not an expert in tech, you are the expert on your child. So you can take that information and bring it to what they're doing online. So some examples, we know that for children with ADHD, if they're neurodiverse, they might have a harder time managing the impulsivity that comes with, using screens more and more and more. Or if a child has autism, it might be harder for them to understand the social, interactions that are happening online. Some other things to think about would be like, what do you know about your child and their reactions to the world, right? Some kids are going to be more sensitive to the environment, so one child might see something online and think, okay, well, it's just a video, it's okay. And then others are going to be more impacted because, again, they just take in more of what's in the world around them. Other things would be like, what are your child's interests? What kinds of content do they prefer? And is their media use able to support a special interest or a skill for them? So again, we know that following a tutorial online to, do a craft is going to be very different from like watching Minecraft gameplay, for example. And I know that all of you in the audience today might have some children of different ages. So for those who really have the wee little ones, the infants out there, at this age, it's obviously, you're still learning about your child, they're still developing, right? So at this point, it can be useful to become more aware of their emotional and cognitive skills, and then that can kind of help you get a sense of how they might react to media as they get older. And then we get into toddlers who have big personalities. Their world is very, very rich. And at that point, we're going to see more differences in reactions to media. So some toddlers are going to be more likely to really, become engaged with the screen, whereas others might just not care about it all that much. And then as we get into the school ages, we see more differences in every child's unique strengths and challenges. And this is maybe the point where, schools might be developing IEPs, right? We might be thinking about how tech can be used to support learning for some kids. And then in the adolescent years, and you're gonna hear me say this quite a few times, like teens have complicated online lives, and especially when they enter like the 10 to 14-year-old age range, we want to be just getting them to start thinking about themselves, right? They have now the capacity to think about what are my strengths, what are my areas of challenge, and teaching them that and then applying it in media use context can be a really helpful way to get the conversation started. And then the second C is really about content. So I'm not going to ask for a show of hands, but I am going to get all of you, if you have a child who plays video games, just mentally, can you think of the titles of, say, 3 of the video games that they play, and what those video games involve? So you can tell, like, you can think, oh, my child plays Roblox, but like, what does that entail? So, and the reason I'm asking you is because it's often harder for parents to think about what their children are doing on screens, understandably, right? It's a more kind of private activity at times. But I think getting a sense of this is useful because we know from research that educational content is related to good outcomes, and entertainment is also okay if it's age appropriate. So we don't want, an 8-year-old to be watching Squid Games. I've heard that too many times. And we also want to be thinking about what influences a child's media choices. So sometimes kids might be, again, seeking out things they're interested in, and then other times it might be because, my friend said that this is interesting. So getting a sense of where that's coming from. And then as kids get older, getting them to more actively evaluate the quality of what they're seeing online. And I think this is especially important in today's day and age where AI is really making it harder to figure out what's real, what's not, what's accurate, what's maybe a bit more, muddy out there. So then if we think about what the content aspect looks like for children and teens of different ages, we know that in infancy, video chats can really help support relationships, whether that's, connecting with a grandparent over FaceTime or something like that. Otherwise, infants don't necessarily really learn as much from other forms of screen use. So the general guidelines by different professional organizations out there really emphasize that we want to just keep it to kind of video chatting for the really, really young ones. And then for toddlers, we know that educational content can be really useful. Things like PBS Kids, other kind of high quality channels can be really enriching because it brings them information that they might not come across in their day-to-day in-person lives. But even then, at that age, it's important to start setting boundaries, right? Of what apps can you use? When can you use them? When should we put the iPad or the phone away? And then as kids get older, they're going to be seeing more and more things online. So for 5 to 10-year-olds, as they see more content and spend more time exploring, it's again useful to get them engaged in conversations, right? About, okay, what did you do with your screen time today? Did you see anything that you like? Can you tell me about what you did in this game? Really just being curious and figuring out, okay, I would like to have a sense of what they're doing. And in that way, if something were to go wrong, it makes it much easier to talk about it, right? And that actually increases the chance of your child coming to you if they see something that's maybe not quite appropriate. And then from 10 to 14, we know that that's the age where a lot of teens start to use social media, even though platforms have that 13-year age limit. We know that it's super easy to bypass that. So if your child is expressing interest in using social media, it can be helpful to look at age-appropriate options, right? So instead of a full-blown Facebook profile, maybe we think about Messenger Kids, maybe we think about other kind of teen-focused platforms. Oftentimes you're gonna get pushback, and that's okay. It's okay to still hold your boundaries. It's really about getting them to explore what's out there. And then again, as older teens start to become much more independent about their media choices, they might say, oh, it's fine, I don't want to talk about what I see online. But we also know that teens still come to parents and caregivers as the primary source of support and information, especially when things get hard. So even then, at this age, it's helpful to come at this from a more, what do you think you're doing? This is what I think I might do, and coming at it from a more collaborative approach as teens want more independence. Okay, the third C, I'm actually really glad that they added this in this updated version of the 5 Cs, is a calm factor. So this is the idea that children and teens need to learn strategies to manage emotions or calm down. And so, we'll get to why this is helpful in just a second, but questions like, how does my child regulate their emotions? And as a part of that, parents need to be modeling what that looks like for kids instead of, it's very easy to be like, oh my gosh, I'm so upset, I need a moment, I'm gonna go on my phone. That's okay, right? And we also just wanna avoid doing that all the time because that makes it much harder for kids to learn what healthy regulation looks like. Another question that I think we frequently get is related to sleep. So a lot of kids will want devices in their bedrooms. I've often heard oh, but my kid wants it for calming music. They want it for rain sounds. That's fine. That's an example of a benefit of media use, right? The thing we want to avoid is, having access to the screen in a way that makes it difficult for them to actually go to sleep. I know there's some to my knowledge, the whole blue light thing has been debated a little bit more recently, but even then we know that devices keep our brains more active, right? They keep us thinking in a way that makes it harder to go to sleep. So if your child does want a device for, calming sounds and such, maybe the solution is to find a Bluetooth speaker and set a timer or something like that. And then last but not least, just thinking about how screens impact sleep quality. So again, we know that screen use close to bedtime can really make it harder to fall asleep. Our brains need a bit more of downtime for that to happen. So oftentimes organizations and physicians and psychologists will suggest turning off the screens like an hour or half an hour before bedtime. Okay, and we also know that self-regulation and calming looks very different for infants and school-age children and teens. So in infancy, we know that fussy babies are more likely to be given media to regulate, right? Oftentimes parents are just saying, you know what, I need you to stop crying. Here is a tablet, here is a phone. And we see that maybe a little bit more in public, right? Where it's really hard to be dealing with an upset baby. In those cases, it's a strategy that parents might turn to here and there, but generally it is recommended that, if infants are upset, we avoid using devices and find other ways to teach them to self-soothe or co-regulate with them. And we know that toddlers have huge emotions. And again, as difficult as it might be, we want to avoid using screens as a calming tool. We want them to be able to experience those big emotions so that they can then learn to kind of regulate after that. And then as we get into the school ages, children often like to use media for a mental break, especially after a long day, right? That's okay, we all do it. We just wanna come home and couch rot for 15 minutes or something. That's fine. We also just wanna be aware of the limits that we're placing around that. So we don't want to be doing that for 4 hours after school, right? Maybe we set some limits, maybe we figure out how we find content that helps you actually calm down and feel good, rather than just distract from something that's difficult. And then similarly for tweens, so these are kids between 10 to 14 or so, they often have many emotions and might turn to media use as an easy distraction. Also okay, but it's also a very automatic process. Even for myself, I think about oh my gosh, this thing happened, it really sucks, let me just open Instagram and look at dogs for 5 minutes, and then before I know it, it's 2 hours. So again, we want to be at an early age getting them to be aware of, why am I picking up my phone? What am I trying to deal with here? And is this actually going to help me in the long term, not just in the short term? And then, similarly, as teens get older, the brain is going to keep changing, the body is going to keep changing, and it's useful to continue working with teens to develop those healthy calming strategies, whether that's just taking a few breaths, thinking things through, talking about it, in addition to maybe using their phone here and there. Okay, so this is the fourth C, it's called crowding out. And I think this one is really more the idea that media gets in the way of other important parts of life sometimes. And I think when parents talk about screen addiction, this is often what's kind of underlying that. So we're gonna spend a bit more time here. So one thing to think about is media use getting in the way of, say, family time or family relationships? And if that's the case, it often helps to figure out not just how a child or a teen is using media, but everyone in the family. So could it be that, a teen isn't using media, but maybe their brother is on their phone all the time, and that's getting in the way of family activities. Or parents, often for those who might work from home, it's really difficult to set those boundaries. So figuring out from a whole family perspective what exactly is going on. And then the other question that I think is really useful to think about is, if you want to reduce screen use, great. What do you want your child to gain from doing that? So beyond just thinking, okay, we're gonna cut you back from 4 hours to 2 hours a day, do you want that extra 2 hours to be used for, say, family time or time outdoors or a new activity, or for older teens, maybe it's you need to go and get a part-time job. So it's really getting kids a little bit more on board so that it's not just you're taking something away, you're also adding to the time that they're finding. And then last but not least, I think a key question is, are screens making it hard for a child to complete their daily responsibilities? And that's often schoolwork or social interactions or, what else do kids do? We get the idea, or developmental tasks. And if that is getting in the way of homework and development, that's often a good indicator that you might want to reach out for some extra help or support. And in terms of this idea of crowding out, it does look different, right, for infants all the way to the teen years. So we know that for infants, media use in the home could impact important activities like speaking or playing. So we just want to be thinking about how they can get those experiences off screen, especially because there is research showing that infants don't necessarily understand the difference between what they see on a screen and in real life, so it's harder for them to kind of translate virtual to physical. And again, for toddlers, we know that screens might detract from play or physical activity and social experiences, and especially the development of those early learning skills, right? Like basic reading, very basic math, counting and things like that. So if screens are kind of getting in the way of that, we can think about how we can shift their screen use to be more educational, or how they can get those educational opportunities off of screens. And then as kids get older, I think this is a nice time to start thinking about design features and how that might promote extended use, right? So this is the age where there's going to be more YouTube viewing, there's going to be more watching Netflix. You might encounter things like autoplay on YouTube, right? So automatically going to the next video without having to click anything. So kids are going to be exposed to more things that hook their attention, and that's going to make it easier for media to crowd things out. So at that age, you want to be getting them to think about, do I really? They're going to say, I want to watch another video, but really getting them to think about, do I want to watch this, or am I going to watch it because it's just going to show up on my screen? And then for adolescents, again, this is the time where device use, they start to own their own phones, right? So you want to be helping them establish balanced use and consistent rules. And there's a few tools that we can use to make that happen. But I think the earlier, if you feel like your child is ready for a phone, the earlier you can get them to start thinking about healthy and balanced use, the better. And then again, as teens get older, you might become you might be more in consulting mode with them. You might be more asking some general probing questions rather than imposing extremely strict, media rules around the home. And then I just wanted to take some time to talk about this idea of technology addiction. So from a mental health perspective, we know that this is a big concern, right? We're seeing things like maybe addictive gaming, problematic social media use. There's a bunch of different words for this. And I think it's helpful to think about media use on a spectrum. So it's very fair that parents and caregivers are concerned about media use, right? We know that teens are spending almost 8 hours online a day. So of course it begs this question of, oh gosh, this can't be healthy. This is more than half of their waking hours. And I think I think what this might mean is that some amount of screen use is normal, and if anything, that's healthy, right? But we want to be thinking about when healthy or typical use gets us more so into the range of unhealthy or what we might call problematic use. And I think the big question, again, is media interfering with or negatively impacting your child's functioning? So it's very normal for toddlers to say, be very upset if they, if it's the end of their show, they don't want to watch anymore, or they're not allowed to watch anymore. But is that a tantrum that's going to continue for the whole day, or is it something that they might calm down from in, say, 20, 30 minutes? And again, is it getting in the way of, say, homework? So is the teen spending all of their time gaming and falling behind in school as a result? Are they becoming more socially isolated? Is it causing maybe health challenges if they're not getting enough physical activity? Or is it causing like mental distress? And what that looks like is often kind of like becoming very preoccupied with gaming, having a hard time stopping social media use even if they want to, those kinds of things. So again, just some different questions that you can think about, right? So are there big changes to your child's personality or sociability? Is there a lot of increased isolation and withdrawal? Are they giving up activities that they used to enjoy? And the final thing I'll say about this is if you are noticing changes, right? Oftentimes the cause is beyond media use. So if a child is really going in and isolating into media and online activities, could it also be that maybe things at school are really hard? Could it also be that there's something else going on? So it's not to say that it's, healthy media use. It's just a way to get you all thinking about the why behind some of the behaviors you might be seeing. Okay, and then last but not least, and I think this is probably my favorite of the 5 C's, is communication. So talking about media early and often. I think a lot of the things that we've talked about thus far really rely on a positive parent-child relationship and a healthy family environment. So really thinking about when is a good time to talk about media with your child. Oftentimes that might be like in the car during drop-offs, right? And we want to avoid those long lectures that can really just bring up the defenses and suddenly you're fighting instead of talking about it. And then other times it might just be taking a second to think, okay, this is something I'm really worried about. It's so normal for this to be a stressful topic. So just taking a deep breath and trying to be aware of that and going into those conversations more open-minded. And that can, we know, really reduce how parents are feeling in terms of like those feelings of guilt that might come up, and it can promote problem solving. All right, for the sake of time, I'm not going to spend too much time on like all the age ranges, but I will say for infants, they might not be able to talk yet, but they are always watching and always listening. So in these cases, it's often useful to be mindful of the nonverbal cues that you're sending. So if your phone goes off and it's in the middle of a conversation, maybe it's a good time to let that notification go for now, come back to and check it later. If my phone were to go off right now and I looked at it, and we would call that kind of technoference, so technology interfering with conversations and relationships. So we want to be aware of that starting from a young age. And then as kids get older, there's more room for communicating, again, about what healthy or good content looks like. And then in the teen years, and also in early childhood, online safety becomes a bigger kind of priority, right? So talking to kids about what it looks like to see like safe online behavior and how they can be safe online and how they can be good digital citizens, right? So what does cyberbullying look like? How might you respond in a more constructive way? And developing a plan. So if you see content that's that makes you feel weird or gross or that you feel like isn't quite right, come talk to me about it. How are we going to problem solve and try to avoid the, oh, I can't believe you saw this online. We want to kind of sidestep those feelings of shame. And then just a quick note on parental controls. We often get questions about, should I use them? Which app should I use? And this is one where I will say, we don't necessarily have like a yes or no answer. Whether you want to use these apps is up to you. I think the thing to be thinking about is, again, this last communication C factor. So letting your child know what controls you're using, when you're using them, why you're using them, and how you're using them. I think one thing that can really undermine trust in relationships, right, is if we're kind of like spying on our kids' media use. We don't want to be doing that. We want to make them aware of the fact that we're there to navigate this with them. So I think at the root of all of this is thinking about how you can continue to build trust and teach your child to have a healthy relationship with technology. And then I know that practical tips are often more welcome by parents and caregivers, and well, just by everyone in general. So I think I'm going to spend the last little bit here talking about the Family Media Plan. So this is a free online resource where if you just Google like the family media plan, one of the first results that come up is going to be a website developed by the American Academy of Pediatrics. I think it starts with healthykids.org. And it's essentially a way to map out like a more holistic, I don't love that word, a more kind of comprehensive media use plan for your whole family. So it essentially lets you to list the names of all the family members who you would like to be included in this family media plan. And then it'll let you pick different areas that you want to prioritize. So in this example, they're prioritizing communication about media, having screen-free zones, and choosing good content. Different families are gonna have different priorities. And then based on what you select in their priorities list, it's going to give you, it's gonna essentially redirect you to different sections of the website where you can decide on specific strategies that everyone will use. So for example, everyone in the family might put away phones at the dinner table, or maybe it's that parents are responsible for not using tech while driving, and kids are responsible for turning off the TV during dinner time, things like that. So there's a few examples here, but I would really encourage all of you to just go online and poke around on that website, see what you come up with. And if you have kids who are able to kind of communicate with you and speak to you about this, oftentimes it helps to like make this with them together, because then they know, okay, this is not just about me, I get to tell my parents what to do, and that's how you get buy-in. Okay, so I think I'm going to wrap up here with a few key messages. And the one big thing I think is not all media use is created equal. We know that based on the 5 C's, especially the content piece. And I want to reiterate that you don't have to be a tech expert. I think I heard during a webinar the other day that sometimes parents are more hesitant to have like the media talk than the sex talk, right? So, and that's because parents are just like, I don't necessarily know what I'm doing. But the thing is, you know your child, right? You're gonna know them better than anyone else. And I think that's the thing to lean on when it comes to supporting them in the digital world. The other piece is curiosity and compassion are really important. Oftentimes kids will use media not because they want to make you angry, because it's just a part of their lives, right? They might come into challenges because that's the way that these things go. And that's a nice opportunity to learn together, especially if you're feeling like you're not really an expert. So, if your child says, I don't really know what's going on with this AI thing, and you don't know either, you guys can learn together about it. And then, as I've mentioned, positive relationships really are the foundation to all of this, and so you can kind of work together there. And then, again, practice what you preach, so really taking the chance to navigate the digital world together, and that allows you to grow together. So learn together, work together, and grow together. That's very corporate sounding, so I'm gonna wrap it up there. So on the screen, I just have a few resources that I wanted to highlight. The QR code is a list that I update every once in a while about some resources that might be useful. It's just a Google Doc, should be accessible. So a few things. So Common Sense Media is a great resource for understanding what age-appropriate media looks like, and they also have a very nice media literacy curriculum. It's actually being adopted in different educational systems. We also know Media Smarts is a Canadian organization that has a lot of tools as well. Children and Screens, there's free webinars, parenting tip sheets, research, so I would encourage you to explore that. And then the Center for Digital Thriving is more focused on how we can get kids to experience the benefits of the online world. Okay, with that, I am going to wrap it up. I know I'm a little bit over time, but thank you all again for listening, and thank you again for having me.
Oh, wonderful. Jasmine, thank you so much for your thoughtful and encouraging session. I really appreciate your balanced approach to the risks and benefits of social media. It's so refreshing to hear more than just the negatives listed over and over and over again. The 5 C's of media use gave me a new framework to reflect on, and the idea that each child is unique has totally tied into the message that we've had today. So very exciting. What's still sticking with me most is that continuum of children across all of the ages. I think there's so much for us to bring in, and it connects to all of us here in some way. So my husband is here with me today, and he doesn't know this yet, but we're really excited to develop a family media plan. Yeah. And it's true, parenting is really hard, right? But your insights made it feel a bit more doable and maybe manageable in this time of some pretty big confusion. So thank you so much for your clarity and reassurance. We really appreciate your time with us today. Thank you. Next, we would like to welcome up Ruth Cordukes. Ruth is a registered nurse and public health nurse for 31 years with the Region of Waterloo Public Health. Ruth has worked with youth for the majority of her career, and since 2018 has been the substance use prevention lead at Public Health. So welcome, Ruth.
Thank you, whoever was right there to help me. That's awesome. Okay. So, up front, I just want to say some of you might not agree with what I say, and that's okay. You might not agree with a lot of what I have to say. That's totally fine. I'm just here to share some information for you to consider. So, I'm going to be talking about substance use as it relates to youth, and I hope that you'll leave feeling a bit more empowered to have conversations with youth if you'd like to have them about substances. So, why youth use substances? We'll be chatting about that. Top substances used by youth, signs of substance use, information to help your conversations with youth, the top 4 substances, strategies for reducing use, and a little bit on where to go for help. So that's a big list. We'll get through as much as we can. I think these slides will be available, possibly, maybe? Okay, so just relax. There's lots of information on the slides. Within the slides, there's lots of links to resources. So again, you'll have the slides, so you don't have to worry about trying to write anything down. Okay. And I also want to acknowledge that you may know a lot about substances already. And certainly, as every speaker has said, you are the expert on your child. Okay, here we go. If I can just get the mouse. Perfect. Oh, my apologies. So, right off the top, the majority of youth report not using substances, but there are some who do. It can be difficult to know, why do youth take those risks? And how much are they even aware of the risks that they're taking? What do they really know about substances? So I want to acknowledge that. There are many reasons why youth use substances. You kind of bucket it into 4 main reasons. They use substances to feel good. Substances can make them feel relaxed, confident, euphoric, right? That's understandable why they might be attracted to those. They want to stop feeling bad, to temporarily stop thinking about their problems, deal with stress, deal with anxiety, maybe deal with chronic pain. Some youth want to perform better at school, thinking it's going to help them, or at work. And some youth are curious. They may be seeing other friends using it. They're curious how it's going to affect them, what does my body do when it comes to substances. It could be that their group of friends use it, so it's kind of the norm, or they may feel almost an unspoken pressure from society to use as part of the culture. And I think, as Dr. Clinton said, people respond differently to substances based on all kinds of factors. So what affects one youth one way may be very different than what another youth experiences. And like our tech speaker, I apologize, I can't remember her name. You can think about substance use, of course, on a continuum. You have all the way from no use to experimenting, which means they may keep using a substance or they might not. It might be just one shot. Then there's social or recreational use. They use it sometimes. And the risk of harm is much lower when you're just using it occasionally. Then there are some youth who are using it because it's prescribed. The more you use, the more often you use, the more the chances are you're going to veer into harmful use. That's excessive use. And when that happens, you're starting to see negative consequences that go along with substance use. But again, they may stay in no use or experimental use or just social use. So just because a youth starts to use a substance does not mean they're going to continue using it, does not mean they're going to experience harm from it, and does not mean they're going to become addicted to it. It's easy to go, oh my gosh, they're going to be addicted. That's not the case. Okay, so the top 4 substances that students report using are alcohol, opioids, cannabis, and vapes. So the data I'm sharing with you is from the province. We don't have local data, but we do know that youth in Waterloo Region are similar to the province. And again, this is what youth are reporting. So you can see that the top substance is alcohol, followed by opioids, followed by cannabis, and then vapes. And this information comes from OSTIS, which is a survey that's conducted every 2 years. They sample students throughout Ontario, and this survey, 2023, they sampled, I think it was 10,000 students completed the survey. So again, substance use reported by youth is not common. It's not the majority of youth. For all the substances, use increases by grade. It goes from a smaller use and gradually gets higher. The one exception is opioids. That use, for some reason, seems to be consistent with every grade level. So on this slide, we can see over time the percentage of students reporting past year drug use. So this, just like the other side, it doesn't mean that they were using every single day. What it means is that they reported using it once in the previous year. So it's the best data we've got, but I just don't want you to think this means that many students are using every single day. They've just reported it once in the previous year. So you'll notice that all substances have been declining, except we've started to see an increase with alcohol, just in the last survey. The good news is that smoking rates are the lowest they've ever been. However, we are starting to see high rates of nicotine use, and we'll chat about those products. So it can be really difficult to know if your child is using substances. I think Dr. Clinton really did a fabulous job helping you with this area. We'll just talk briefly about some of the signs. Some of these behaviors are associated with substance use, but it does not mean substances are automatically involved. When you see this, we sometimes see substance use, but it could be mental health issues. It could be all kinds of things. But the behaviors, right, changes at school. Well, that could be due to a lot of things, but you might see kids missing classes. Their grades start to slip. They're having trouble getting there on time. They're maybe having discipline problems. Maybe they're not so interested in the things they used to love to do. They may be pulling away from relationships. They're not hanging out with the friends they normally used to hang out with. Maybe they're not hanging out with the family as much. And again, some of this can be a growth and development thing. Some of this is natural for teenagers, right? So it's taking the big picture, and it's, do I need to dig deeper? Don't automatically assume this means that there's substances involved, but it's just a data for you to add to your pot of data. They may want to have more privacy, not wanting you to look in their backpack or see what's in their room. It could be that you're seeing a very different physical appearance, maybe drastic weight loss, maybe weight gain. Maybe they are having trouble with sleeping a lot, not sleeping at all. So you can see how lots of things can be causing this, but that's when you're going to want to do some digging deeper. You might see valuable items go missing. The money that you gave them, they can't account for. Maybe they're asking for a bigger allowance or to borrow more money. Maybe they're giving you very interesting stories that don't make any sense. Again, sometimes kids do that, but so you see what I mean? It's complicated. They might be overly defensive. And you may see changes in how they're thinking. So if they had anxiety and depression, you might see it go worsen, or you might see it start. Again, could be due to substances, maybe not. The good news is one of the most effective things you can do, like Dr. Clinton said, and like your last speaker said, is having conversations with youth. When you give youth information about risks, then when you're not with them, that information is there to help them make more informed choices. So forcing youth to not use substances is not an effective strategy. The most effective strategy, as I said, is educating about risks. The following is messaging for youth that use substances. So, of course, from public health, I would always say it's best not to use. That would be fabulous. The reality is a certain percentage of youth will ignore that and will try substances. So giving them messaging to reduce the risks can be really helpful. So if you decide to use, it's best to wait till you're older, because then your brain has developed more and it's less vulnerable. Telling them that it's actually illegal for youth 17 years of age and younger to use cannabis, alcohol, vapes, non-prescription opioids, as well as substances from the illegal market. Adults, however, 18 years of age and older, they can choose to legally use cannabis, vapes, and alcohol. That's because they're adults. We would say to youth, as much as possible, avoid using daily, avoid high amounts. The more you use, the more often you use, the higher the amounts, the more the risks go up. So, good news is, the less often they use, the less amounts they use, the lower the risks go down. So, use less, fewer hits, smoke, vape, or drink less and less often. Avoid mixing substances, avoid illegal sources, avoid using alone, use with people who have your back. If there's a history of psychosis in your family where you see, hear, feel, or think things that aren't real, then our message is these youth should not be using cannabis at all. It's just too risky for them. And by family, I mean brother, sister, aunt, uncle, mom, or dad, grandparents. Avoid driving after using substances. Pour your own drink. Keep your eyes on your drink. Drink slowly. Stay hydrated with non-alcoholic or caffeinated drinks. Avoid using substances on an empty stomach. So you can see you don't want to have this conversation all at once. This is a lot. So you can spread it out, right? It's a continual conversation. This is not a one and done. This is not, it's a lot of information. Tell youth, listen to your own experiences. They may never tell you, but if they have a bad experience, listen to that. It doesn't mean you have to try it again. That could be a sign. Keep substances locked away and out of reach of children and pets, and that goes for parents, and that also goes for youth. Avoid self-medicating. If they're self-medicating, if they're using daily, that's often a sign that they're self-medicating. Then let them know that we can get you help. We can figure out whatever's going on and give you an alternative so you don't need to choose substances to deal with whatever's happening. And you can raise dopamine and those happy chemicals in really fun ways. Going for walks, being out in nature, sunshine, dancing, music. Like, there's lots of great stuff. It's easy to do. Easy to do. Hugging your friends and family, playing with pets. It's fabulous. Okay, so one of the most important conversations you can have with your child is about traveling safely, right? So plan a safe ride home for your child. Discourage your child from getting into a car with someone who has used any alcohol, cannabis, or any drugs, because they're young drivers, they're inexperienced, and these substances are impairing. They impair the parts of the body that are responsible for reflexes, for thinking and judging, and all kinds of things. And there's a zero tolerance for that reason for drivers. Young drivers are not allowed to have any substances. So tell them to call you or a trusted friend, use a code word with them, encourage them to stay over at their friend's place if it's safe, encourage them to never walk alone at night. If possible, give them a bus ticket or a pass, set them up a rideshare account, send them with cab fare. And just use your community resources. Use your friends, your family, your neighbors. Bring everyone in to help you with your kids. So, okay. As I said, the four most commonly used substances: alcohol, opioids, cannabis, and vapes. We're going to start with alcohol. Okay. So, the biggest thing to know about alcohol is that drinking a lot very quickly is one of the biggest risks for youth. In Ontario, the average age of the first alcohol drink is 14.5 years of age. Youth report accessing alcohol from a family member or at home. That's most youth who are accessing alcohol. Just so you know. And alcohol is a depressant, which means it slows down your brain, which means that your body's affected as well. So drinking very large amounts all at once can slow your heart rate and your breathing down to really dangerously low levels. However, to complicate things, it can also raise your heart rate at times and cause palpitations. So this is an image of a Borg, which stands for Blackout Rage Gallon. And what this is something that became popular on TikTok, where you go to a party, you fill it up with vodka, water, Kool-Aid, or a flavoring of some kind, and you carry it around with you. That's your drink for the night. So these kinds of things are great to talk to your youth about. Have you ever heard about this? What do you think about this? So young people are at a higher risk for negative impacts because their brain is still developing. So binge drinking, having a lot of drinks on one occasion, is really risky. Drinking to get very drunk really increases the risks of negative effects, of course. Okay, so talking to youth about overconsumption can be really helpful. Letting them know about the risks, because like many substances, if you overconsume alcohol, youth may do things that they would never do when they're sober. They could be quite embarrassed after the fact, and it can be quite risky. So having conversations about that is great. Youth often, as I said, underestimate how much they drink, so helping them to know what actually a standard drink is, so that when they count drinks, they go, oh, okay, maybe that is a lot. That can be helpful. Sorry, I'm trying to find my mouse. Where did it go? I'll just do that. Okay. So just with alcohol use, these are great messages to share for any substance. Make sure someone knows where you're going, when you're going to be home. Avoid situations you're uncomfortable with. Never accept a drink from anyone you do not completely trust or a substance. Be aware of what's going on around you. Don't drink anything that you did not see poured, opened yourself, or that someone else gave you, no matter what the circumstances. Always watch your drink. If you leave it unattended for any amount of time, dump it and get a fresh one. Travel in groups. 3 or more people is best. Friends should take care of friends and be observant of any strange behavior, such as slurred speech and lack of alertness. So if they return to their drink and it's been moved, it looks different, appears to have been topped up, discard it. And if they begin to feel really drunk after only 1 or 2 drinks, get help from a trusted friend. If there's an adult around, get help from an adult that they can trust. Or if they're in a commercial space, then get help from a staff member. Go to a safe place as soon as possible. Okay, now we're going to talk about opioids. So these are drugs that were created to deal with really severe pain like cancer pain. And when used properly, when they're prescribed and you're under medical supervision, they can be really effective. What we're concerned about is when they're used inappropriately, when youth are using them. So one of the biggest problems is that there are substances that are now being produced illegally that mimic the look of prescription medications. And so I'll show you a picture in a second that would be a good one to show youth. And when they're created illegally, they're not produced in commercial labs, they're not following regulations, they're not trying to think about consumer safety, They're not worried about laws and regulations, so you don't know how much of the opioid is in there. You don't know what type of opioid it is. You don't know if there's fentanyl. You don't know if there's other chemicals. And this is really great to share with youth. So it may have a much stronger risk of overdose, those illegal opioids. So pills should never be trusted from an unknown source is a great message to share with youth. So fentanyl, you've probably heard a lot about it. It is a very strong opioid. It is dangerous, and small amounts can cause really serious harm. So when the opioids are combined with alcohol or other medications or drugs, then the risks go up. That's the image I was speaking of about legal versus illegal opioids. So many young people mistakenly believe that prescription opioids are safer than street drugs. They think that because opioids are prescribed by doctors or dentists, using these drugs is not as dangerous as using drugs such as cocaine or methamphetamine, and that's a myth. Opioids are powerful medications, and misusing them can be harmful for a variety of reasons. So it can be at least as harmful as using alcohol or street drugs. Great message to share with youth. Also, it's illegal for anyone without a prescription to possess, use, or share prescription opioids. If they're found in a student's locker or car, the person can be charged with possession of drugs. More than 2/3 of students, 67%, reported using opioid painkillers non-medically, and they reported getting them from home. And there's lots of reasons why they do this. They don't understand the risks of taking drugs that are not prescribed for them. They think the drugs are safe because they're made in a pharmaceutical facility and have been prescribed, as I said. It's easier to get than street drugs, and they haven't yet learned other ways to cope with stress or unpleasant feelings. So when you deal with all the drivers of what's causing them to use substance, you can really lower the risk. So illegal opioids, they are around, but I think just chatting with youth and saying opioids generally, illegal ones are more risky, but any opioids, if you're not prescribed them, you shouldn't be using them. Okay. So to reduce the risk when it comes to opioids, there are things you can do. Education, as we've been hammering today, for sure. So have those clear conversations. And if there are opioids being used in the home, negotiate clear rules about their use. Make sure that those opioids are stored and locked away. Keep track of the number of the pills in the container and watch to see if any of them go missing. If the number of pills don't match your normal use, or you need to refill your prescription sooner than expected, someone else may be taking those pills. And always follow the directions on the label. Call your healthcare provider if you have questions. Never share your medication. And model safe and appropriate use of medications. At least once a year, clean out your medicine cabinet and bring any leftover or old medications to your local pharmacist. So don't worry, there's lots of links. I've got pamphlets on my tables. There's from School Mental Health Ontario. They've got some great resources around opioids. I'm just giving you a little snapshot, but there's lots of information for you. So for example, signs of an opioid overdose. There's information on our website at Public Health. Basically, you're looking for a change in skin color. You're looking for someone who's having difficulty waking up. They seem to be drowsy or difficulty staying awake. And the bottom line is, you're going to look at this like first aid. If you saw anyone who was having trouble waking up, you would want to call 911, right? If there's something going on. If you suspect that maybe there was opioids involved, you can give naloxone if you're comfortable. And I do have a video linked here on how to give naloxone. It's just an option for you, and it's general first aid principles that you're going to follow. And if you want to learn more about first aid, then, you know, St. John's Ambulance, there's all kinds of places where you can learn more about first aid. But this is just to let you know there are things that you can do if there is a situation where someone appears to be having an overdose. And again, remembering that the majority of students report not using substances, just to keep that in mind. Okay, cannabis. So the big thing about cannabis is just to know that it does come from a plant. Kids think that because it's from a plant, it's natural, so it's safe. But natural does not mean safe. It does have hundreds of cannabinoids. The two big ones are THC and CBD. The THC is responsible for that feeling high. The CBD causes the relaxation and the drowsiness. And nowadays, legally, you can buy products that are very concentrated with large amounts of THC, 95% THC. Dried weed now has 25 to 35% THC. So there's a lot to know. You can always go to a cannabis store if you want to learn more about what's out there and what these different percentages mean and to get educated. But it's tricky. Edibles legally can have a maximum of 10 grams of THC per package. Okay, the risk of cannabis use by youth. The higher the amount of THC, the higher the risk of harm, especially if they are a first-time or inexperienced user. Occasional use has risks. It can be addictive. It can affect brain development, but the brain can heal. And brain development, as I said, isn't complete until age 25. And it may make any mental health issue worse, and it's been associated with anxiety and depression for some people. So this image right there, that's a cannabis vape called watermelon sugar. I know. So these are images of legal cannabis edibles. You can come to my booth at the end. I've got pictures of illegal and legal samples, I should say, of packages. The packaging doesn't appeal to youth. It contains a maximum of 10 milligrams. It has a yellow box warning, and it has the approved symbol of the cannabis leaf. That's how you can tell that it's from a legal source, and kids need to know that. The trouble with edibles is just that when you smoke or vape cannabis, it goes to your bloodstream really quickly, and when you use edibles, it takes time. It can take 2 hours to start to feel the effects and 4 hours to feel the full effects. So it's really easy for youth to think, oh my gosh, it's not working, I'll just take more. And then they can very quickly overconsume cannabis. So again, a great reason to have a conversation about this. You may find different cannabis tools in your home. There's homemade bongs and pipes, there are grinders, there's papers, but you might not find anything. So you can't automatically assume because you haven't found anything, there's nothing going on. And I'm not trying to suggest you become detectives. That's not the kind of parenting I'm suggesting. It's just if you do, that may indicate that they're using cannabis. Or they could be holding it for a friend. And all this is to say, we're not going to enforce our way out of this, and this is not a school issue alone. This is a community issue, right? This is a very complex, challenging issue, and I applaud the school boards for addressing this. It's difficult. They're very concerned about your youth. So vaping, this is what you're more likely to see this. Not that they vape more than they use the other substance, but it's just more visible. You know, the sweet-smelling smells, the devices, which again you can see at my table. So vaping is the act of inhaling or exhaling a vapor. The liquid is is heated by the vape, and it turns into this very fine mist. Kids think that it's flavored air. They don't like it when you tell them that they've been inhaling chemicals. So that's a good thing. Once they know that there's chemicals in there, it becomes much less appealing. So the only thing their lungs were designed to do is to filter out air. If they're breathing anything else in, it has chemicals, and there's a potential for harm. So that's an easy message to share with youth. Oh, and by the way, your school boards have curriculum for grades 7 to 12 students on cannabis and vaping. that we've worked together on. We've also got some new grade 6 curriculum and some youth champions in both high schools, peer educators. So there's lots going on around education. So, key messages to share with youth. Nicotine's highly addictive. It's not good for your brain. It makes it harder to remember. It makes it harder to think clearly, like a lot of substances. It makes it harder to control your emotions, to pay attention, and to learn. Again, like many substances. So, it's also important to let your youth know that, like many substances, there is help available to help them cut down or quit. Okay, there's a new product. It's called nicotine pouches. You may have seen them. They are little pouches of moistened fiber, and they are soaked with nicotine and flavorings and water. And you put it between your cheek and your gum, and that's how they absorb nicotine. We do not recommend these for youth. Because of the nicotine, not a good idea. But just so you're aware, that's another good product to talk to them about. They are now being sold only behind a pharmacy counter, but it's possible that kids are being exposed to them by dealers who are passing them around. But they have become more difficult to obtain, which is great. There's also a new product called cottonmouth balls. They're like a very, very small very small pouch, and it's a bit more stealth. They're also soaked with nicotine, and you do the same thing with them. And again, we would not recommend these for youth. Okay, so there are lots of things that you can do, and you're more powerful than you know. I heard this a lot when I was in the high schools with youth. They would tell me how much what their parents thought influenced them. So encourage your child's participation in doing the things that they love. Get to know your teen's friends and their parents, and maybe invite them over to your house. Stay in touch with a trusted adult your child knows, and enlist them as part of your team. Spend time together as a family and have fun as much as you can. That bond, those memories, those positive experiences you can draw on when you need to have difficult conversations, and it will help your child when they're making difficult decisions. It'll be, what would my parents think? I don't want to disappoint my parents. I care how they feel about me. My parents want the best for me. So again, even when you're absent, you can be very present in your child's mind. So, as all the speakers have said, be involved in your child's life. Know what they're doing. Know where they are. Ideally, they have adults who are supervising the activities. Establish rules and consequences. Reward them for the good things when they do the good things, and enforce the consequences. It's not fun, but the research shows that it's effective. And remind your child that you will always support them no matter what. Going back to what Dr. Clinton said about those messages, right? I care about you. I want you to be happy. I want you to be safe. I want you to talk to me. You're more important, as opposed to what you do. I'm upset about what you do. Getting that message about you care about them no matter what. Okay. So there are wonderful supports available here 24/7. We've got lots of them here today. We've got, I wanted to highlight, we've got Ray of Hope, Porch Light, Front Door. There's a new program through the Center for Addiction and Mental Health. It's called Youth Vast, and it's free, it's virtual. You don't have to drive to Toronto. It's online groups, there's counseling, individual, and 12 to 21 youth 12 to 21 can access, and it's to help youth with problems with vaping technology and substance use issues, dependence. So it's a brand new resource, and they're great as an option for you. Drug Free Kids Canada, fantastic place. It's got a hub for parents, all kinds of information about how to have conversations, tons of information about substances, and they have a line 24/7 hotline that you can call to get support. One Stop Talk, a great place funded by the Ministry of Health. If you want to talk to a professional, a counselor, just once. It's not ongoing, but if you're in crisis and you just really want to get an opinion, you can talk to them once. A youth can talk to them, a parent can talk to them. And it's confidential and free. There's also something called the Breaking Free from Substance Use. This is an app and it's a website, and it uses a variety of approaches, cognitive behavioral therapy, mindfulness, strategies to help youth who have substance use issues. So it's a recovery program online. It's not live. There's also some apps for vaping cessation, but the principles they use for vaping cessation can be used for any substance. So the Quash app, there's a brief conversations toolkit that goes along with the Quash website. It's fantastic. There's a Not an Experiment website where they can actually fill out a downloadable quit plan. So there's lots and lots of resources out there for you. Okay, so there's one other thing. I'm just going to quickly skip through. I hope it doesn't turn on. It turned on. Oh, geez. Shoot. So this is a video you can watch at a later date. It's 5 minutes long, so I'm just going to figure out how to, yeah. But it's a great video. Oh, lovely. Thank you for your patience. I know that was a lot. And as I said, I'm here to chat with you at the end. But you've got fantastic community agencies that work directly with youth around treatment. And they're amazing to talk to as well. Okay.
Where did she go? Oh, there you are. I wanted to make eye contact while I thank you, Ruth. Thank you so much. I appreciate you so much and sharing with us such valuable insights into the current trends and risks and protective strategies around youth, substance use, and mental health. And for highlighting again, as we've heard throughout all of the talks today, about the importance of relationship and connection when it comes to supporting our kids as a protective factor. Your expertise has helped to equip us all, parents, caregivers, and school partners with the knowledge that we need to better support our young people. We're grateful for our partnership with you in this important work. So thank you so much, Ruth. A round of applause for her. So we know that these topics and parenting in general can feel overwhelming, and we want you all to know that you're not alone in supporting the well-being of the young people in your lives. As we mentioned to you earlier when we were getting started, as a province, schools are supported and guided by School Mental Health Ontario, which provides evidence-informed resources, tools, and training to help school boards support student mental health. So at our boards, we use this aligned and integrated model. We call it the AIM model, which guides our work across 3 interconnected tiers. So at tier 1, we build the foundations through whole school and classroom strategies to create safe and welcoming environments and strengthen mental health literacy. And then at tier 2 is where we notice and we provide early support for students who might be beginning to struggle. At tier 3, we bridge students to community services when more intensive help is needed. And these efforts are all grounded in the values of equity, engagement, and evidence, ensuring that we support every student together using what works. And in our community, both boards are deeply committed to promoting student well-being across all 3 of these tiers. And so we have some examples to share with you today. At that foundational tier 1 level, we focus on mental health promotion and prevention for every student. At both boards, this includes curriculum-based lessons like the grade 7 and 8 mental health modules. Grade 10 careers course has a mental health component, as well as partnerships such as the Youth Champion initiative that we work together with Public Health, a youth-led adult-supported substance use prevention program. Both boards also collaborate with the Waterloo Region Suicide Prevention Council on programs like Sources of Strength, which empowers students with knowledge about mental health and well-being and how to seek support. And we provide professional development and resources to staff, helping to create mentally healthy classroom environments where every student feels supported. And then when students are struggling more, we move into those Tier 2 and Tier 3 areas where we provide targeted interventions and specialized supports. So this often involves connecting students and families to our community partners, many of whom are here with us today. We really are truly fortunate in the Waterloo region to have a strong, coordinated network of social service organizations working alongside schools to support the well-being of our children, youth, and their families. So today's speaker's messages beautifully aligns with this aligned and integrated model for school mental health. At that foundational level, we focus on creating those welcoming, inclusive spaces where strong home and school partnerships support our children. Dr. Jean Clinton reminded us that positive relationships grounded in communication and compassion and connection are really that foundation for helping young people thrive. Along with boundaries, I added that after. So it's not just the communication and the compassion, we have the boundaries at the same time that we hold firm. Jasmine Zhang helped us to explore how parents in the digital age sharing the 5 C's about media use. So understanding your child, thinking critically about content, supporting that emotional regulation with calm, noticing when media is crowding out other life activities, and then fostering that open, curious communication. So these are everyday strategies that help us to create supportive environments so that our children feel safe, heard, and understood at that good for all Tier 1 level. And then at the notice level, Ruth Cordukes, our public health expert, gave us practical tools to recognize the early signs of risk, whether it's vaping or alcohol, cannabis, or opioid use, and how to take early steps to reduce harm and to bolster resilience. And we learned that conversations matter, not just from a place of fear, but from curiosity and care and non-judgmental listening. We also heard about concrete strategies like family media plans and safe storage of substances that reduce risks at home. And then at that bridge level, we want to remind you that your family is not alone with all of this. When more intensive help is needed, we do have community programs and school-based supports that are ready to step in and provide care. So before you leave today, please do ensure that you spend some time with our local community organizations and that you pick up a postcard at our table that looks like this. This has information on both our local community organizations, helplines, and then on the reverse side, School Mental Health Ontario's parent portal, which will give you access to all of these different tip sheets that you've seen today.
Almost there. May 5th to 11th is Mental Health Week in Canada, and conversations will be happening across the country, including in your children's schools and classrooms, to build awareness and reduce stigma. We can't think of a better way to head into that week than by being here together to consider the well-being of our children and youth, to learn and reflect together on how we can support this next generation to thrive. We are so very grateful to our presenters, our community partners, and to all of you for taking time out of your busy lives on a Saturday to engage with us on these important topics. Being a young person today is not easy, and parenting is not easy. We hope you're leaving with at least one new idea, nugget of wisdom, or strategy that feels relevant and useful to you and your family. Thank you for coming. We'll now turn it over to Whitney and Katrina.
Feedback is really important for events like this so that we can plan for maybe a future event. Having a combined collaborative event for Waterloo Catholic and Waterloo Region has been so great. And I think bringing everyone together is really important. So if we can hear from you so that if in future we can do one of these events, that would be really wonderful. We also have to report to the ministry, so that's another reason, okay? Okay. We want to thank our caterers for the great food that was offered today. We also want to thank our tech crew. I can't tell you how much relief we had here that we didn't have to set it all up, and there was someone here on site to help us with the tech and to record it. So what's even better is we will take that recording and email it out to you. We know that there were people that weren't here today, and maybe you want to share the wonderful speakers that were here. that could be something that we do. Okay. We also want to thank the Family Center. What a beautiful space for us to meet in today. It was great. We are really grateful for this partnership between our boards. And then, what else? Special thank you to Andrea and Emily and Heather. It has been a real pleasure working together to organize this event for our community. So, well done. Okay, now, did you all get this QR code? Did you all take it? Yeah, you promise? Okay, it's also in your agenda, so you can get it there. But, you know, I don't know about you, but if I don't do it right now, it's probably not happening. So in the email, I'll send it again, but if you can do it now, that's great. Thank you very much, everyone, for coming out today.